Hey, good morning. It is so great to be with you again. Really appreciate all the time that you spend here hanging out with us on Saturday mornings. Life is busy. I'm glad you fit us into your day. Thanks so much. And also want to say a special hello to all those people listening across the country on the WOWO live stream or after the fact on the podcast. I know life is busy and you can't always be here on Saturday mornings, but you can catch us anytime while you're mowing the lawn, at the gym, whatever. We're really glad to have you listening wherever you choose to do that. You know, during the week, I read dozens of medical journals and studies, and I came across something today that I'm going to tie into a mission trip that our guest today, Dr. Dave Deal from DuPont Family Dentistry, recently took to the Dominican Republic. We're going to learn a little bit about dentistry and dental care as part of an outreach for some really impoverished people. But I want to bring that back around here to something that matters to you very closely, and that is the importance of having your teeth cleaned because of what it does to the rest of your body. Researchers have now documented that the bacteria that forms on your teeth, when it gets into your bloodstream, can really cause havoc. It produces a protein that accelerates clotting in the blood, and that can lead to stroke, heart attack, dementia. Even they think there's a connection to Alzheimer's. So there is a very practical reason for folks to get in and get their teeth cleaned. It's not just about having a pretty smile. It goes much deeper than that. And then we're going to tie that back into just poverty in our country as well, in an effort by the folks at DuPont Family Dentistry to help more people in our own community improve their dental care. So we have a lot to get to today. So welcome to Dave Deal from DuPont Family Dentistry. Good to have you here.
Thank you for having us.
And also joining us today is Dr. Allison Fiesel, also from DuPont Family Dentistry. Good morning.
Good morning. Thank you.
I'm so glad you guys are here. So what is it that you're doing when you're cleaning my teeth that I can't do myself?
Well, first things, I want to say thank you for bringing attention to this. Just the fact that you laid out that message you just did, it's impressive that you spend the time to do the research to figure this stuff out and kind of understand this. So sincerely, just your knowledge of this is awesome. On our end of things, it's one of the things that we struggle with. You know, people think in terms, oh, a simple cleaning, I'm getting a simple cleaning, and there's so much more to it than that. You know, plaque setting on your teeth long time, these types of bacteria that you're talking about, as they're there longer and longer, you build up gingivitis and eventually turns into periodontitis, and you get that bleeding when you brush your teeth or you're flossing. That's when those bacteria are being introduced to your bloodstream. Once they're in there, that's where things start happening that you don't want to have happen. And everything you laid out is completely true and accurate. So a regular cleaning is not just a cleaning. It is a part of your oral health. It is part of your entire body health, your entire whole health. And it's critical. It really is.
So when you are cleaning my teeth, I think people know, I mean, you've been through it. They're poking around in there and scraping and stuff. And what is it that you're doing on that I can't do, that the toothbrush can't get to, Allison?
So the toothbrush can remove soft plaque, the soft bacteria, but over time with the minerals in your mouth, it will harden. And so you could be the best toothbrusher in the world, but you won't be able to remove it when it turns to that hard deposit. So when you come in and the hygienist is scaling and removing that plaque, they're also removing that hard deposit, that bacteria that's mineralized on your teeth as well.
Got it. Okay. So, yeah, you just can't get that done yourself. Now I want to tie this back into your mission trip because Dr. Dave just got back from a trip down to the Dominican Republic where he was working with some really impoverished people. And you told me something that I thought was really surprising. Tell me, repeat that so the audience can hear what you found in the mouths of people who haven't been to the dentist for years compared to folks here in our country.
Yeah, so often I'm asked, you know, hey, you must see some really bad things on these mission trips. And we do. We see some things that are really sad. But the reality is we see worse, more unhealthy mouths in America than we do when we're on the mission trips. And it's really amazing to me. Allison's seen it as well. You know, yes, we can see some things that starts in childhood with kids that they're mainly fed sugar as kids, you know, that's the only nutrients they can get. But when you get into our diets and you get into our neglect, you know, we have so much more of what's the word I'm looking for? A challenge. We have more sugars, we have more carbohydrates, we have more different things. Less people choose not to brush their teeth. And so the damage that we get from our diet is actually worse than what they get from their diets. And so, yeah, we see if I were to show you a series of photos and you tell me, pick out where this mouth comes from, I think you'd be shocked.
Wow, that's interesting.
Yeah.
Okay, so that gets us further down the road to, you see people every week who haven't been to the dentist for 5 years, longer than that, right?
Yeah, sure. Yes.
So what is our mission today to get people off the dime and to take that step?
Yeah. Again, people tell me all the time, hey, I heard you on the radio, I heard you on TV, and I finally got motivated to come in. And I'm so thankful that I'm finally here and all that. We love those stories. One of my big things is that I just wish people would come in earlier. We get so far down that road that it's so bad, it's expensive, it's cost to, there's a lot of things that get involved. So the earlier we treat, the better. The biggest thing that I want to hopefully encourage people with is, like, when you make that choice to come into us or anywhere you decide to go, and you start building that healthy smile, you get that relationship, and you're doing good things for yourself. At DuPont Family Dentistry, we have decided to give back in the best way we know how. If a person comes in and they go through what we call a same-day smile program, and they decide to do that kind of stuff and rehab their mouth, we're going to make a donation to Matthew 25. Matthew 25 does very similar things that we do, but they do it for a different population of people. And what we'd like to do is make a donation that would be equivalent to like an upper denture or a lower denture. So if you come in and get your smile fixed for us, we're going to make a donation of Matthew 25 so that somebody else can be blessed with the same type of care through Matthew 25 that they can't afford it on their own.
Oh, that's great. So I think, Allison, you're on the board at Matthew 25. Tell people, I don't know that the community really knows about the dental side of Matthew 25.
Yeah, it's the dental. So Matthew 25 is a nonprofit, gospel-inspired healthcare center, and there's a dental component as well. And there's a connection between, as we've been talking this morning, the health of the mouth and the health of the rest of the body. So we kind of look at it as the healthcare center treating the whole person. There's a dental, there's a medical, there's vision, there's mental health services as well. But the dental component is a full functioning clinic. There's a dentist on staff and a hygienist on staff. And so the patients that we see, they come in a lot of times from all different walks of life, and they're just wanting to, again, they haven't been to the dentist for maybe 5-10 years and wanting to kind of get their lives back on track, maybe look for a new job. And so there's a lot of different services that are offered. Extractions, there's cleanings, there's partials and dentures. And so we kind of can do that same-day smile type situation with the dentures and the partials that we provide for our patients there as well.
So, yeah, these are folks who there's just no way they're going to be able to have dental care in any other environment. So, yeah, that's fantastic. Yeah. Matthew 25, such an asset to the community. So I'm kind of curious, if you haven't been to the dentist for a number of years, what's your reason? Is it fear? Is it guilt? Is it expense? What's going on? What's causing you not to go? Shoot me a text at 46862, 46862. I'd like to hear from your experience about what's keeping you from going to the dentist. And we're going to talk a lot more about what happened on the mission trip with Dr. Dave, and then some other impact of having a smile and how that changes lives for people when we come back with more of the Health Call Live Radio Hour here on WOWO. Welcome back to the program, where you're here with Dr. Dave Deal from DuPont Family Dentistry and Allison Fiesel, another dentist at DuPont Family Dentistry, talking about delayed dental care. But also I want to jump back into your mission trip down to the Dominican Republic. Mm-hmm. You told me something I thought was really interesting, and that is it's hard to come back to the U.S. after having spent a week down there and seeing the conditions. Tell us more about what you see and what their life is like, and how that whole ministry of dentistry works down there.
Well, if I can jump in a little bit, the hardest thing is that when you talk about poverty in America, it's a certain vision of that. When you go to a place like Dominican Republic or Haiti, it's a total different. You can't compare the two. A poor person here would be considered very wealthy there. So when we're there, we literally treat people that they live off the trash of the city. They don't have access to clean water. They don't have access to electricity on a regular basis or whatever. And if they have clean clothes, it's their only clean clothes. And so we deal with people that are. It's very hard, to see how they live. And so that shock of seeing how they live and seeing where they live, and then coming back here and realizing that when we go through Starbucks and get a $5 cup of coffee, You literally could feed a family at least for a day, if not a week. And so it's hard. It's a struggle, and I'm sure if anybody's listening has been on a mission trip, you get it. So it takes time to kind of, when you come back into America, it takes time to reacclimate.
And so you guys are treating patients for a week while you're down there. What are the condition that you're seeing in their mouths? So you told me earlier that candy is cheaper than food, and so parents have a tough decision to make down there.
Yeah, I think that's one of the most heartbreaking things that we see in children. We'll have a child that will come in with a 6-year molar that has just erupted and it's already needing to be extracted. The poverty conditions are so extreme that they don't have access to food, so if they have candy, if the mom has candy and her child is hungry and crying, that's what she resorts to. And so we see that really impact the health of the teeth as well. So that is definitely one of the most heartbreaking things to see, for sure.
And I'm guessing that they have no choice for dental care other than the mission work that you folks and others do, right?
Yeah, pretty much.
Wow. That's tough. Well, there are people in our country that don't go to the dentist often enough, certainly, and fear and anxiety, fear of pain, fear of the cost, fear of lots of things are one of the reasons. What can you do to help me if I'm just one of those people who's so darn anxious? What are you going to do for me when I come to the office?
Well, first things first, it's complete. Often I hear people say, this is so different than I thought it was going to be. Yes, there's chairs and there's some things that look visually the same, but the tools that we use are dramatically different than they were 10, 15, 20 years ago. So getting your teeth cleaned is a much more pleasant experience. Doing the x-rays and the exam process, we make it as gentle and kind as we possibly can. And for those people that are extremely nervous, and sometimes we do this, we can set up to have sedation done for them for their exam. And that happens once in a while. So, from the moment you get in, the exam process, we make it as simple, as painless as possible. I mean, there's no pain. And try to get this person as comfortable as they can. When we transition into the treatment side of things, we have a lot of options as far as sedation goes. We're from nitrous oxide, which works really well just to take the edge off, oral sedation, and if we need to, we can do IV sedation. And so we kind of we can get a person to a place where they're basically asleep, and we get the dentistry done, and when they wake up, it's over with, and that helps a lot of people out. A lot of people we see really want that.
Well, I get it.
Yeah.
There was a period where I was kind of one of those guys. I think I went several years without going to the dentist. I don't know what happened in my brain to trigger that phobia, but it's real. 25% of the nation, I just read a study, 25% of people in the country have this anxiety to the extent that they can't make it into the dentist's office. And I get it. I was one of those people for a while, and I had to get over it. And a little Xanax helped. I have to tell you the truth. It kind of got me through that. That's great. I want to bounce back for a second to what you're doing with your donation to Matthew 25. Okay. And so, Allison, tell me about the impact that's going to have. If you're going to create a partial or a plate or whatever you're going to do for those folks, what impact is that going to have in their life?
Well, I'll tell you a story. I just had a patient reach out to me this past week, and he was someone that I had seen at Matthew 25 back 2013, 2014, and he found me in private practice, and it was just really cool to reconnect with him. He said, I don't know if you remember me or not, but I was homeless at the time whenever I saw you, and I was, trying to get back on my feet, and he was on that journey, and so he was really grateful that we were able to help him with that and to give him a new smile. And so he had lost one of his plates, so he came back and found me in private practice. But it was just so cool to see him, to see that he has a job, to see he's engaged, and he's just on a great track in life. So it really, really makes a difference in someone's life. I've had patients that have been in tears that haven't been able to smile for 10 years. So to be able to help our neighbor where they're at, it's a real honor. So it does make a tremendous difference.
Yeah, we talked before, Dave, about the confidence that having good teeth can really change somebody's life.
Yeah.
Tell me more about that.
Just like Allison said, the change that they were able to help with that man, and he was able to find a job, and now he was able to come to our office and get care done in the more traditional way. And it's just so rewarding. So, taking a person that's ashamed of their smile, whether it's their teeth are so bad. And just the fact that they can smile. I mean, you don't really need to go much further than that. It's life-changing. It really is life-changing. You know, yes, you can talk about confidence and getting a job and all those things. Those are all great, wonderful things too. But just to be able to give the gift of a healthy smile for someone, whether it's a set of dentures or it's new teeth, you know, or implants or whatever it is, those things are transformative. Really, really transformative. And I know, like I said before, people tell me all the time, I've been listening to you, I've been listening to you. And I think there's people that are hearing this, that they get this and they understand it. And I just encourage them, take a step forward, invest in yourself. You know, stop living the way that you've lived, make a change. You come and see us, see somebody, make it happen.
Yeah, and just to recap for those who may not have been listening earlier in the hour, tell us again about what you're going to be doing here for folks and specifically to help the Matthew 25 Clinic.
Yeah, so the patients that we see typically can afford the type of work that we do, you know, whether they finance or they pay for it. And the gift that, you know, they're giving for themselves, we want Matthew 25 has been a bigger part of my life because of Dr. Feasel. And knowing what they do there, which is essentially the same difference, we've always been like, how can we help? How can we help? And how can we give back? And so we made the choice with your help in this conversation that when a patient comes in and gets, you know, whatever it may be done, if we do a full mouth rehab or we do a same-day smile, we're going to give the gift of an equivalent amount so that a person can go to Matthew 25 and get an upper plate or a lower plate or maybe both. And because that's a big hurdle for a lot of these people at Matthew 25, just coming up with the money to pay for the basics. And so hopefully this is a, you know, you bless yourself with a smile, you're going to bless somebody else with a smile.
Yeah, that's a great way to think about it. And, you know, I have shared before on this program, I'll do it again right now, the confidence that you can achieve through getting that dental work done, it affected my life. It changed the cosmetic work that I had done, gave me the confidence to move ahead into a broadcasting career and many other things. So if you're one of those folks out there who just is uncomfortable about the condition of your smile, take that step. It can be life-changing to have that work fixed. It really does. It changes how confident you're going to be in a job interview. It changes the way people react to you. You know, people do let's just get real. People are very judgmental, and if you see somebody with kind of gnarly looking teeth that are not well cared for, you make a value judgment about that person. People just do.
Yeah, and it's all walks of life. There's no, you know, we see people on a very high-end level of income all the way down to very poor. This affects every segment of life.
Yeah, well, so I think it's great that you're going to do what you're doing there, and that's super.
I'm excited about it. It's going to be fun.
Okay, so that is Dr. Dave Deal and Dr. Allison Feasel from DuPont Family Dentistry. You can find them online at DuPontFamilyDentistry.com. Their office is at 1025, that is 10215 DuPont Circle West, up there near DuPont Hospital. Guys, thanks so much. Great to see you again.
Thank you.